Hi, my name is Carlyn. I'm a master's research student for the University of Calgary at the Sport Injury Prevention Research Centre, and I'm a strength coach that has been working with Volleyball Alberta for the past 4 years, developing warm-up programs and strength training programs, preparing our athletes to get on the court and train at a high level. So what we're going to do today is go over one of the neuromuscular training warm-ups that we have developed. Neuromuscular training is a type of strength training and movement training that is designed to reduce injuries. So we see a 40 to 60% reduction in acute injuries in athletes, especially in the knee and ankle, when we go through this movement prep and challenge our athletes to improve their movement patterns and develop their strength further throughout the season. So what we're going to be doing today is going over a few variations of those exercises, level 1 and level 2, and you can pick for your athletes what might be the most appropriate place to start for them. The key is once they're starting to get bored or it's looking too easy is to go to that next level. So a lot of times athletes will start with rolling. They're nice and sore from all their training sessions earlier today. So if we're going to do pre-practice rolling, it's going to be a quick roll over the body part that's sore through the calves, through the quads. They're not trying to necessarily work out a huge knot at that time, but just get blood flowing to that muscle area. When we're done our rolling, we're going to go into opening up through the hips and our off-court hip mobility and back mobility movement. So a lot of times you don't have a ton of core time to be working with, so I'll get athletes to show up 15 to 20 minutes early to start doing some of this pre-practice rolling and movement prep. So what we're going to begin with is loosening up our hip flexor. If our hip flexors are too tight, that will actually inhibit me from being able to jump nice and high. And you guys want to be jumping as high as possible in volleyball. Yes, that's why you're in this sport. So if my hip flexor is too tight, it will inhibit my glute muscles, which means I can't jump quite as high. It might also affect my stability through my leg. So we're going to get them to begin with their front ankle behind the front knee. You're going to take your fist, put it on the glute, contract your glute, tip your hips in, and then just gently go forward until you feel a little bit of a stretch there. So you should feel that down the front of your quads. Okay, and we're going to hold that for a couple seconds and then back off. Okay, and then again, go forward a little bit. And it helps to have the knee pads on the knees for this so it doesn't hurt. And then back and forth. So keep going there. So again, kids spend a lot of time sitting throughout the day, so their hip flexors are in a short end position. So when they come in the gym, we want to get them to loosen that up a little bit. So our next progression we can do is taking the back arm here. We're going to reach it up to the roof, drop forward. And again, what we're going to avoid is any extension, hyperextension through the lower back. We want to keep that hip stable. We're going to extend through the rib cage and reach to the side to intensify that stretch. Okay, and so again, we would do that through left and right side normally. We'll just do the one side for today. So next we're going to go into our back mobility. So for our spine, we want to warm our back up in what's called triplanar core sequencing, which is through a correct 3 planes of movement in the correct order. So we're going to go into cat-cow. So they're going to have their fingers wide apart, hands under the shoulders. We're going to round the back up, tuck the chin in, and trying to get movement through the T-spine and the lower back. And then we're going to go into extension, teeth together, looking up at the roof, get extension through the neck and through the upper back. And then pull back in. And again, pulling up through here. Good. And extending. So depending on how tight their backs are, we might go through 5 to 10 cycles of this. And then what we're going to do after our flexion extension is we're going to actually go into lateral flexion. So this is a really gentle way to warm the spine up and be gentle on the discs. So you're going to look towards your back shin and stretch out like an accordion through the rib from the shoulder, and then look at the other side. And so we're stretching through the side of the shoulder and just looking at that back hip, and we're going to keep your hips stable so your hips are locked here. Good. And then drop to the other side. Great. So again, anywhere from 5 to 10 per side. What I commonly see happen is lots of people go into rotation or lower back mobility without doing these first 2 movements first. So we want to make sure that, like I said, we're getting the spine a little bit warmer before we put it into more vulnerable positions. So for our rotation, there's a few options you can do for this. We're gonna start with one in a kind of lunge position with our hand either on our foot or down. So it's gonna depend how tight your hips are. So you're gonna put your hand here, we're gonna have this hand here, and we're gonna open up our thoracic spine, so our upper back, looking up at our hand right up to the roof, watching that our hand isn't dropping towards our butt, keep it up by the shoulder, and then rotate down. And again, keeping your eyes on your thumbs. And so you'll get a little stretch through the hip there. And then the athlete will just rotate as far as they can. What you want to cue them to do is to contract the shoulder blade here to stabilize the shoulder blade, and then that will help them get more of that rotation and stretch. So we want to teach them an active rotation versus just a passive one. Okay, and then the next thing you can do for rotation, so if this one is a little bit tighter for them or harder, we can actually just do a half kneeling one to each side and just follow that elbow, so tipping forward a little bit. So hand on the back of the head, and they're keeping their core stable. And then let your eyes follow your elbow. Keep this stable, and then go look there. So that would be my next progression to have a bit more of an active rotation. So this is important obviously for our hitting, our serving, and opening up to the ball. Next, we're gonna go into some of our glute and lower body activation. So you guys can lay on your stomachs, forehead on the hands, elbows out to the side. What we're gonna do is start to get that glute max firing. So you're gonna have the athlete bring their heel over the knee. Their knees don't need to be together in the middle. We actually want them slightly apart. That's gonna be more where they're jumping from, is not knees here. So the athlete's then gonna take their hand, put it on the glute. Just reach back there. You're gonna squeeze your glutes together, forehead down, and then just lift your knee a little bit off the ground. And we're focusing on using the glute to lift the leg and then relax down. And you're gonna hold that for 5 counts. So squeeze the glute, lift the knee, keep the feet relaxed, press both hips evenly into the ground, and then relax, good. And again, and we're gonna do 5 each side. So 5 times 5 seconds. Watch the relax here. They're not tensing too much through their upper back. You can cue them to contract their abdominals. And then if they're getting a hamstring cramp, it's probably that the hamstring's contracting before the glute. So again, they're gonna work on cueing that glute muscle to contract first, and also that it's not the lower back. Try again there. Good. The progression for this exercise would be going into a double leg glute bridge, so you guys can flip over. So oftentimes you'll find athletes might have one side stronger than the other, or there's a firing pattern that's off a little bit. So I'll tend to keep them at that first progression for a few weeks, and then we would go into our double leg glute bridge. So they're just gonna, again, have thumbs on the glutes to give them that cue to activate and lift up, and then hold that, and then drop down. And this one I'll cue them to, again, connect this to jumping. So when you jump, you extend your hips, and we want to contract our glutes as we do that. Okay, so that's what you're going to visualize while you're doing this one. Okay, and up and down again. Watching that we want to avoid any hyperextension in the lower back, or that drop your hips a little, they're right down here, heels a little bit further away. So walk them away from me, perfect. Okay, so again, we want it to ankles under the knee. Good. So again, anywhere from 5 to 10 reps with that. Now we're gonna go into our hamstring drops, so you guys are gonna partner up. So developing hamstring strength is one of the most important things you could do for preventing against an ACL injury, and especially in girls volleyball. So what we're gonna do, let's actually go sideways here. So you're gonna hold your partner's ankles here. What they're gonna do is drop forward with hands up all the way to the ground and land in that push-up position, okay? So you're gonna go as slow as you can, yeah, and drop forward with hands up, good, and cushion that landing. So 2 things, it warms up our upper body on that landing, but we're working our core and our hamstrings here. So again, shoulders and hips are gonna drop at the same time, drop forward, good, and nice and slow down. So what you wanna watch the athlete from doing, a lot of them when they're first scared to do this one, you can flip, Do you want to trade? Should we have you doing that on the hand? Is breaking at the hips. So can you show me a bad one? Yeah, okay, good. One up. It's a little dangerous. We're living dangerously here. Okay, so we're always going to keep our hands up. Okay, and then drop forward. So just going to keep that core strong and not bend at the hips. Okay, great. So next we're going to go into our torso activation and planking. So you guys are going to go into front plank. So a lot of lower back injuries and overuse injuries in volleyball, again, their abdominals are one of the most important areas we could strengthen, again, for hitting, blocking, having bilateral symmetry for passing. So you're going to bring your head back up to my hand here. So I'm going to get them to start with this for about 20 to 30 seconds. Now, these girls are really strong, so they find this super easy, right? And so they're going to show us another version of it. So they're going to lift their right leg just a bit off the ground, and you'll see how strong they are because they're keeping their lower back pretty stable. And then try the left side. So they're doing that glute contraction. Great job. And then just keep alternating sides. Okay, and then the other progression we can do for this one to warm those shoulders up more is a scapular retraction. So dropping between the shoulder blades and then loosening and pushing away and stretching that shirt up. Yeah, and they've been doing this for at least a minute now, so I guess I'll give them a break. Okay, then we'll go into our oblique activation and our glute med. So we'll go into side plank. So for this one, we're gonna have bottom knee bent, top leg straight, elbow tucked in under you, lift that hip up. So it's really important on this one to keep your hip as high off the ground as you can, okay? So if you have someone with a shoulder issue or an injury, you may need to move to a straight arm plank, and that's great. So you're gonna have, so have this knee bent right underneath you. Push up a little more and rotate this hip forward more. Good. So I'm gonna get the athlete into the correct position first, and then we're gonna lift the leg up from there, and they should feel that bottom hip working a little bit. Yes. They're shaking, they're working. Remind them to breathe. So again, this is another activation they can hold for about 5 counts and then lower that leg. The progression for this would be you can move to a full side plank. So try both legs straight. And again, keeping that hip up nice and high. And yeah, right up through here. You'll see a lot of them sinking there. That's okay. Good, and reach that arm right up. Okay, and then we can thread the needle, rotate through, and come back up. Remember to keep breathing. Awesome. Okay, take a rest. So their activation is pretty much complete. I think they're kind of warm already.